Hi friends, welcome to classes by Lab Doctor. In our previous classes, we have seen what is this prothrombin and how does it help in coagulation. So you know that prothrombin is a protein, okay, and this protein is produced in the liver and it is a vitamin K dependent factor. There are various other factors also, 7, 9, 10. These are the vitamin K dependent factors. Okay, so this prothrombin is an important protein which helps in the evaluating the extrinsic as well as your common pathway. So we have studied in detail about this protein prothrombin in our previous class. But understand that this prothrombin test, what we do, it measures how much time your blood takes to clot. Okay? If there is an injury, you start bleeding. Your body has to stop the bleeding. You can't keep on bleeding, isn't it? So how much time your body takes or the blood takes to clot, that is assessed by this pathway, that is your prothrombin time. This will assess your extrinsic pathway, which is initiated by an external injury, and also the common pathway. So now, when does the doctor order this test prothrombin? So you know prothrombin is a very commonly ordered test. You can see that it is ordered in majority of the patients, and what specific reasons why the doctor orders this is that if the doctor is suspecting any bleeding disorders, to check for the deficiencies in any clotting factors, etc., this will be the first line of investigation. The doctor has put the patient on blood thinners, so to monitor the treatment, especially your warfarin, so to see the treatment, how it is working, then the doctor will initiate this PT test. I've told you that PT is produced in the liver. Liver failure patient because of cirrhosis, alcoholic liver disease, hepatitis, etc., the prothrombin time will be very high. To assess the liver function, we use PT. Patient has an surgery, and to see once they cut open whether he will stop bleeding, is there any deficiency. The doctor doesn't want the patient to bleed profusely on the OT table, so before surgery this test is usually ordered. All these are the conditions wherein doctors orders this prothrombin time. So now how much is the normal prothrombin time? The normal prothrombin time is 11 to 14 seconds. That means for the blood to clot, it should take around 11 to 14 seconds. But what happens? This PT, this estimation of PT and the prothrombin time as such, it is not standardized in all the labs. So to standardize this, we have something called as the International Normalized Ratio. So we will study about INR in detail, but remember this INR is a standard measure and this should be within 0.8 to 1.1 in healthy individuals who are not on any kind of an anticoagulant therapy, blood thinners, etc. Okay, so if the doctor puts the patient on any kind of an anticoagulant, the doctor wants his INR to be between 2 to 3 times the control value. Okay, so that would suggest a proper anticoagulation. So you will see that the INR value is between 2 to 3. Otherwise, in normal individual, it would be from 0.8 to 1.1. Okay, so if the PT is coming more than 30 seconds, up to 14 seconds is normal. अगर 30 seconds आ रहा है, that means blood is taking long time to clot. Clotting is not happening. Patient will be bleeding. So there can be serious bleeding. He can bleed into the internal organs. There can be death also. Okay. So PT more than 30 seconds or the INR more than 5. needs immediate hospitalization, and this has to be informed to the clinician. PT more than 30 and INR more than 5. Okay. So here you can see the report of this patient. So here it is the patient's value which has come, and this is the normalized ratio. I've told you it is between 0.8 to 1.1. So this is, here it is written that INR is a parameter of choice in monitoring adequacy of oral anticoagulant therapy. Appropriate therapeutic range varies with the disease and treatment. For example, if the patient is put on anticoagulant therapy for venous thrombosis, pulmonary embolism, heart valves, valvular heart disease, atrial fibrillation, or for the bileaflet mechanical valve in aortic position, etc., the doctor sees that his INR is between 2 to 3. So whatever results you get, you have to correlate it with clinically, because there are various factors which might give you wrong results also. Many pre-analytical errors, if the sample was not collected properly in the citrate tube, if the sample was clotted, they can all give a false PT. So you have to correlate clinically, and this test is conducted on a citrated plasma. Remember, PT is not a fixed value. What is more standardized and what is more important would be your INR. PT can vary, but INR is in that context, it has come to standardize this value. So PT can vary, but INR is a standardized value. So now what are the symptoms when the patient has prolonged PT? So I told you, if the PT is prolonged, if it is taking more time to clot, that means patient is bleeding, isn't it? So here, whenever the PT is more, patients will have symptoms of bleeding. Or suppose if the patient is having excessive bleeding, normally by that time the bleeding should stop, but you see a child or you see a gentleman or a lady who is coming with a nosebleeds, or who is having bleeding, it's not stopping after a small trauma also. The bruises are appearing without a clear injury. Patient is having bleeding gums. Doctor will think, is there any problem with the clotting? So that time doctors orders this prothrombin time. So whenever there are signs of excessive bleeding, okay, suppose if there is a patient who comes and tells doctor that he is getting all this bluish patches, for no reason he is getting these bluish patches, it's bruises, there is no any history of injury, etc., then the doctors will think, is there any problem with his clotting? So he will order a prothrombin time. Patient is coming that there is nosebleed. He is not hurt anything, he is not picked his nose anything, but there is bleeding from the nose. Why there is bleeding from the nose? Is there any problem in the blood to clot? So they'll do a PT. Bleeding gums. There is no gum infection, etc. Still the patient is having bleeding in the gums. Doctor will order this PT. Suppose if a lady comes, she says that she is having heavy periods. There is no particular reason, her ultrasound, etc., are normal. There are no fibroid, adenomyosis, etc. Absolutely fine. But she is having heavy blood flow. One of the factors for this could be that there is no proper clotting happening. Her PT might be prolonged. So that also can be a symptom of increased PT. Patient is bleeding inside the genitourinary tract. So he will pass blood in the urine. So blood in the urine doesn't mean that he is having clotting problem, but one of the reason for hematuria could be your prolonged PT. There are other reasons also. It could be a kidney stone, it could be trauma, etc. But if the patient is not able to clot the blood, then also there can be bleeding inside the genitourinary tract, and patient can have blood in the urine or hematuria. So small cuts which will be bleeding more than usual for a longer period in a normal individual, that will immediately stop and there will be no bleeding. But in few people, what happens, even if there is a small cut, there will be increased bleed more than the usual. Okay, so such symptoms will prompt the doctor to check his PT whether there is any problem with his clotting factors. Sometimes patient have internal bleeding, like patient, suppose if there was an intracranial in the hemorrhage, so patient will have severe headache. A sudden severe headache might suggest that there is a bleeding in the brain. There is an excruciating pain and the headache is very severe in such cases. Patient can bleed inside the GI tract. He can have black stools. Okay, I've told you patient can bleed in the genitourinary tract. So that time the patient will have red colored urine. Sometimes the patient might vomit blood. It looks like a coffee ground, vomitus. So that also suggests that patient is having an internal bleeding. Patient can just lose his consciousness whenever there is a severe bleeding. Because of this severe internal bleeding, hypotension, etc., patient can lose consciousness. So these can also be the symptoms which are associated with the prolonged PT. Okay, so from minor bruising to severe internal bleeding, all can increase the prothrombin time. So PT-INR test is the test which measures the time taken for your blood to clot. In certain condition, whenever there is a problem with the clotting mechanism, the PT, the prothrombin time might be increased. And if the doctor sees symptoms of unusual bleeding, like he's having nosebleeds, he's having gum bleeds, there is blood in his urine, there is bleeding or bruising, doctors orders this test, that is your prothrombin time. Okay, so what are the symptoms of high prothrombin time? It could be very severe symptoms like headache, losing consciousness, vomiting blood or a coffee ground blood, or the blood in the stools, or hematuria, blood in the urine. This could be because of internal bleeding. And some symptoms like patient is having bruising, there is no injury, there are all blue patches on his body, or patient is having a bleeding gum, patient is having nosebleeds, patient is taking usually longer time for the blood to clot, then also doctors might order this prothrombin time. Okay, so that was all about the normal prothrombin time and the symptoms. Remember, if the prothrombin time goes more than 30 seconds, it has to be informed to the clinician, and also if the INR is more than 5, it has to be informed to the clinician, because there is severe risk of bleeding if it is not managed appropriately. So thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.